Good morning, colleagues. Um, I'm Dr. Santosh. I'm sorry for my absence. I'm trying to make this presentation through the audiovisual technology. Here I'm presenting smoker study, which is smoking in Caribbean. I'm here to present the prevalence and disparities of smoking and gingival health in Jamaica, Dominican Republic, and Puerto Rico. I thank you for this opportunity given by the third summit of Caribbean Oral Health Initiative. So the contents of this presentation is the summary, introduction, materials and method, results, discussion, conclusion, and reference. A main aim of this study was to estimate the prevalence of smoking and the disparities in the capital cities of the three Caribbean regions at Jamaica, Dominican Republic, and Puerto Rico. And our secondary objective was to identify or assess the prevalence and severity of gingivitis in relation to the smoking practice in the above captioned three regions. In regards to methodology, the study population comprised around 1,847 and the patients were 18 years and above. And these were the volunteers, participants from the capitals of the state countries like Jamaica, Dominican Republic, and Puerto Rico Island. And the structured interview was used to assess the participants' smoking behavior. The participants were classified as the current smokers, past smokers, and never smokers. And after the interview, we did an oral examination and evaluated the status of the periodontal or gingival health. The gingival index was used to determine the extent of the gingival inflammation. To summarize the results, the majority of the participants were never smokers, with current smokers being found most commonly in the Kingston, that is 33.22 percentage, and that's followed by San Juan, Puerto Rico, 12.76 percentage, and finally the Santo Domingo that showed 8.8 percentage. Both current and past smoking was strongly associated with the severe gingivitis. The conclusion was the results indicated that there is a high prevalence of light smokers in the participating Caribbean countries, and smoking was the most prevalent thing in Jamaicans and the least prevalent in Dominican Republicans. And the study population of the current smokers were found to have a fourfold higher risk of severe gingivitis and twofold higher risk of moderate gingivitis. The important risk factor for the periodontal disease is the smoking, that is stated by Eki et al. In 2012. They conducted the study in the United States, and WHO recently in 2013, based on their fifth target with regards to non-communicable disease and the mental health. They wanted to have at least a 30% of relative reduction in the prevalence of current tobacco use in persons aged 15 years and above during the year 2015 to 2020. So according to WHO in 2013, they said that tobacco kills approximately 6 million people and causes more than $500 billion of economic damage each year. Evidently, the study suggested that there is a causal association between the tobacco smoking and periodontal disease. Page and Beck et al. In 1997, they stated that smoking have a five-fold higher risk of developing periodontal disease in comparison to the non-smokers. Although periodontal disease is a microbial in nature, the tobacco smoking is associated with a higher susceptibility of the periodontal pathogens, meaning it has an affinity towards the periodontal pathogens, and causes tissue destruction. Salvi et al. In 1997, they stated that it is also probably due to that immunosuppression activity and exaggerated inflammatory cell response in persons with smoking habit. There was another study. They also suggested that in the gingival crevicular fluid of the patients who have a smoking habit, they seems to have a altered cytokine profile and immune cell function as well as a proteolytic regulation. All these things can contribute in the formation of the periodontal disease or establishment of the periodontal disease. We tried to archive the data from WHO in 2017, and we identified that Jamaica has a prevalence of tobacco smoking in the youth was like a 17.8 percentage and 14.5 percentage in adults. In Dominican Republic, it was reported to be like a 4.7 percentage in youth and 17.6 percentage in adults. In Puerto Rico, it was 13.1 percentage, regardless to the age. So the our search actually suggested that there was evidence about the smoking practice, but no studies has been conducted in regards to smoking and gingival disease in Jamaica, and probably it was done in the Dominican Republic or Puerto Rico. So hence this study was to look at the collaborative approach in regards to the prevalence and the disparities of the tobacco smoking practice and the different types of smoking practice, as well as compare the severity of the gingival infections. Right. The methodology is almost as same as the Dr. Toro's from the presentation or the parent. This is there's a study from the parental study from the gum infections in Caribbean. So the methodology remains same. So I'm going to skip on to this section. I'm going to go to the results section. In regards to results to the demographics, the sex and the age and the education, it is clearly evident that males are like have a increased number in all categories, current, past, and never. They are almost like a 28.94 percentage current smokers, 18.88 percentage of past smokers, and 51.93 percentage of never smokers. And the never smokers were like higher in the females, 74.94 percentage. And looking at the current smokers, if you look at the age band, it is more among the 20 to 29 age group. That's almost 23.72 percentage. 30 to 39 age group is 23.78 percentage, and 73 patients, that means 21.44 percentage in the 40 to 49. So we can actually suggest that majority of the smokers in the study was identified in the age group between 20 to 49, and being highest in the 20 to 29, and so gradually decreases as it goes to 40 to 49. And looking at the current smokers, the majority of the smokers has been identified in the middle or technical school level. They start like that's the education they have it, and they are the one who smoke highest. It's almost 26.1 percentage. You know that is about the smoking practice according to the characteristics of education. This is an interesting slide here. We are trying to look at the smoking by the city of residence. If you can actually look at this slide here, it suggests that Kingston, Santo Domingo, San Juan, in the current population of the smokers, you see the most highest group is Kingston, that is 233 patients was been identified. That reflects to 38.22 percentage, which is followed by San Juan, that is 12.76 percentage, and finally Santo Domingo, 54 patients, and it was 8.8 percentage. And the right hand of the table, that shows the smoking habits. Like a never smokers has been like highly identified in the Santo Domingo. That's 76.91 percentage, has been never smokers, and second highest is San Juan, that is 68.68 percentage. And least person said about in Kingston, it's a 47 percentage of the patients approximately said that they never smoke. The past smokers were higher in the San Juan, that is 18.56 percentage, which is followed by like Santo Domingo, and then the Kingston. In regards to the current smokers, the light smokers are higher in the Kingston, Jamaica, almost like 38.22 percentage, and San Juan is 12.76 percentage, at least in Santo Domingo 8.8 percentage. Then moderate smokers, we see that 1.81 percentage in the Kingston, and almost zero. Like nobody state as a moderate smokers in San Juan, and only one person seems to be reported in Santo Domingo. Heavy smokers are again high in the Kingston. 15 patients have been reported, and it equates to 2.46 percentage. And if you look at the product used or type of the product, smoking product used, San Juan reported to be having a more number of cigarette smoking, that is 126 patients contributes to 20.64 percentage, whereas in Kingston is almost like a 14.49 percentage of population said that they smoke a cigarette. Whereas that's because probably because of the Kingston, in Jamaica people smoke a lot of marijuana. If you look at the marijuana smoking is 27.61%, which we can also interpret the data this way. There are a lot of patients who actually identify to be like marijuana smokers in regards to Kingston. There should be like a potential gap for the next new study. Slide is to indicate the gingivitis severity in smoking. If you look at the multivariate adjusted section of the right side of the table, the current smokers actually has a 2.21 fold of developing of the moderate gingivitis versus the mild gingivitis, and severe gingivitis is more likely to be in almost like a four-fold higher risk of development of gingivitis in comparison to the mild gingivitis. Getting to the discussion, this study actually documented the prevalence of current smokers as 19.93 percentage, and past smokers of 15.53 percentage, and never smokers as a 64.37 percentage. There was this study definitely document a higher proportion of the smoking individuals in the age group of 20 to 49 years old, that is almost like a 68.94 percentage, and more males has been identified to be current smokers, that is almost 28.94% in male, whereas in comparison to 12.28 percentage in females. The same applies to the past smokers, was also more among the men, that is 18.88 percentage, followed by the female is 12.69 percentage. This is also another interesting area to look at the adjacent neighboring countries, like prevalence of smoking in the Caribbean countries like Trinidad and Tobago. It showed a 31.9 percentage. Brazil is like a 16.1 percentage, stated by the Muraro in 2013, and Guyana is like a 15.3 percentage. That's a WHO report. Comparing with the earlier findings, the disparities in the smoking behavior within the Caribbean and Latin American region have been observed, maybe due to the social demographics, financial status, cultural heritage, and or the different policies on smoking in the respective nations. We also looked at the smoking and the living status, and the results documented that the higher rates of smoking was found among the persons who reported to be living alone than comparing with the persons who are living with their spouse. The similar results was being identified, similar kind of interpretation was identified in the Californian study, which was conducted by the Conradi et al. In 2017, where they indicated that smoking was most common among the people who are independent or single living, and then the married persons. On contrary, one of the Asian countries, China, indicated that married persons seems to be more likely to be smoking than the persons who are living alone. This is interpretation taken from the Wang et al. Study in 2014. So thus, while smoking is more prevalent in married Asians who are living in Asia than in those who live alone, this is opposite is true in the Western culture. So the further studies are required to more closely explore the association of marriage status and smoking. What is the reason and all those stuff. We have to do some kind of social characteristic study in future. This slide is to show that document evidence of the higher prevalence of smoking in Kingston is being higher, that is 38.22 percentage, and followed by San Juan, Puerto Rico, 12.76 percentage, and then Santo Domingo, that is 8.8 percentage. The higher prevalence seen in Jamaica may be due to the easy availability of marijuana in the country, and to the cultural practices like the Rastafari members of a religious and social movement based in Jamaica. In regards to Puerto Rico, the smoking seems to be linked to the financial difficulties, emotional stress, and cultural heritage. And this interpretation was taken from some of the publications from the American Heart Association in 2018, Gonzalez et al. In 2013, and Menzi et al. In 2015, and Ortiz et al. 2008, and Preston et al. In 2001. This slide is trying to show the critical insight into the smoking practice in regards to the light, moderate, and severe smokers. The present study definitely confirmed that the majority of the smokers was in Kingston, like in Kingston is the light smokers, that is one who smokes 1 to 10 cigarettes per day. That's almost like 33.94 percentage, whereas the heavy smokers like a 2.46 percentage, and the moderate smokers was 1.81 percentage. Interestingly, the data from San Juan also show that of those who reported to be there, they were current smokers, and all of them were light smokers, and no one reported either as a moderate or a heavy smoker. In regards to Santo Domingo, the majority of smokers were light smokers, that is 1 to 10 cigarettes per day, which is followed by heavy smokers and moderate smokers. Overall, we can suggest this way, 17.46% of total participants were light smokers, and 1.21 percentage were like heavy smokers. The study actually identified that majority of the smokers in these researched area is where the light smokers. Although the study identifies the light smokers seems to be more prevalent, we may not conclude saying that as a statement here. The light smokers prevalence may be in the study document may be due to the underestimation, because the current study relied on a self-reporting, and non-daily smokers may classify themselves simply as the non-smokers. Additionally, sometimes the workplace restrictions on smoking and the policies that promote restriction of smoking in home with children may have exacerbated such underreporting, might have been existed. This slide is to show about the marijuana smoking practice in the research countries. It showed the highest prevalence of marijuana smoking in the Jamaican, that is almost like a 27.61 percentage, and we also identified some of the marijuana smokers in Puerto Rico, that's a 0.65 percentage, and there was no marijuana smoking being reported in the study from the Dominican Republic. Moreover, we can also look at this way, like marijuana smokers seems to be more prevalent than the cigarette smoking in Jamaica, but in Puerto Rico it is otherwise around, in meaning cigarette smokers were higher than the marijuana smokers. I said previously that the higher prevalence of marijuana smoking in Jamaica is probably due to the local availability of the substance, that is a marijuana or a ganja, and seems to be associated with the cultural significance, probably because of the association of the Rastafarians. It seems to be likely that relatively low prevalence of in Puerto Rico, even though the fact remains it is illegal to smoke in the island. This slide is to talk about the risk of developing gingivitis. The results of this study definitely show the current smokers have a fourfold increased risk of developing chance of severe gingivitis versus mild gingivitis, and a twofold increased risk of having moderate gingivitis. Based on the available literature, we identified that severe gingivitis is probably due to the attachment loss and gingival recession. And these both parameters are highly prevalent in smokers but less so in non-smokers. Prior to concluding, we would like to state that the analysis of the data collected from the partnering countries in Caribbean demonstrates the high burdens of gingivitis associated with smoking, as stated, with a fourfold increased risk of developing severe gingivitis and twofold risk of moderate gingivitis. Our findings are from the existence of smoking disparities thought to have been present in the participating countries. To conclude, this study actually indicated that light smokers are more prevalent in the study population throughout the Jamaica, Dominican Republic, and Puerto Rico. And the findings also suggested that higher prevalence of smoking is seen in Jamaica, as well as higher prevalence of marijuana smoking is most common among the Jamaicans. Here's a small video clip on our study. Please have a watch. These are some of our references for this presentation. At this moment, I would like to thank all the patients who participated in this study, our sponsors COHI and Colgate, and all the institutions, participating institutions and the ministries of health. And thank you all for the patient listening, and thank you COHI Third Summit for giving this opportunity to present and allowing to use a technology media to present in my absence. Thank you.